My dad had high blood pressure, he had a stroke. My mum had a stroke. My sister's diabetic, she has heart problems. So it's in the family.
It's in the family.
Yeah.
She has noticed a painful lump. I think she needs to be seen.
That is the most uncomfortablest thing I've probably ever had, but I don't care how.
I am so sorry.
When you're younger, you hit yourself and you go, and of course, but I'm getting older, so I'm forgetting things, but I don't remember banging it.
The main artery was over 70% furred up. They said she was a major stroke waiting to happen.
I thought, oh Christ, when you're bleeding from the ear, you know, you should think to yourself, you know.
The end is nigh, yeah.
Near, yeah.
Barnum Road Surgery, how can I help? 9:10 it was, she's missed it. We don't have 10:09 appointments, it was 9:10. So you need to phone back at 12:30 for an afternoon appointment. Okay then, bye-bye.
Lauren Manning? Dr. Hyder, come through and have a seat. How can I help you today?
For about a year, it was not long after I had him, waking up in the morning and not being able to move my hands.
Oh, okay.
When he was really little, I'd wake up in the middle of the night and I couldn't even unscrew a bottle to make his milk. And then it's calmed down, and then I just found out that I'm pregnant again. And the first sort of 4 weeks, they were terrible, to the point where in the morning I couldn't even get them dressed.
Right.
I spoke to my mum about it, and she's had carpal tunnel. And she said to me, it sounds similar.
Do you feel tingling?
Yeah, you know, before you get pins and needles, you get that dead arm sensation. It's just like that. You can't do anything
And it's
with
both
it.
hands?
Both hands.
Any visual problems?
Sometimes things go a bit blurry. I don't know if that's just from having two kids and just not having enough sleep.
Okay, so how often does that happen?
I don't know, I don't even take much notice. I'll just be driving and think, oh God, my eye's gone a bit funny. Steady.
And is that one eye or both, do you think?
Probably my left, I would say.
Okay, so is it all right if I examine you? I want to
Yeah.
examine the nerves that supply your head and neck, and then your arms as well.
Yeah?
Okay.
Can you not?
So I believe you've been referred to have your knee looked at by the orthopaedic people. And,
I have, yes.
And have you seen them yet or not?
No, I've got an appointment at Heatherwood Hospital on the 28th.
OK, right, good. OK, so that's underway.
Yes.
And this is with a query as to whether they'll go ahead and replace the whole knee. OK.
Yeah.
So the question is, can I help you in the interim by injecting into the knee to see whether it calms it down a little bit for you? And the answer is yes, I can. Are you happy for me to go ahead?
Yes.
OK, mate, I'll get this injection ready.
Okay.
A couple of things about it. Firstly, it's a steroid. It may flare it up for a few days, OK, before it starts to work.
But I've had it before.
OK, so you know
So I know what happens, yeah.
OK.
So the last time I had it in the hospital,
Yep.
suddenly started to feel frightened to death because someone went in before me and there was a massive scream. And all of a sudden, there was doctors and nurses flying from everywhere.
No.
It stopped breathing.
No.
Yeah. And I thought, I've got to go and have that now.
Well, I'm going to try and avoid that today. Come and have a lie up here for me.
OK.
If we can get you up here.
Yeah. I struggle sometimes to get into the bath.
There was a thing on the news a few weeks ago. There was that dear old lady. She took a bath and couldn't get out. She was in there for 4 days. And she survived. But the reason she survived is because on every Wednesday she used to go down to the same cafe. And when she didn't turn up, they got really worried about her. So they went round to a house and heard her calling and got the police and pulled the door down. It's a lovely story. But,
yeah, that could be me, you know.
What do you reckon? Make sure you start going to some place all the time with some nice stuff. I need you to try and relax that as much as you can so it's as floppy, really. You're doing well. Still with me?
Yes, I'm still with you.
Right, it may hurt for a few days.
Okay.
Hopefully after that it will just sort of ease off.
Yeah,
Nice to
you're
see
very
you.
lucky. Yeah, nice to see you. Thank you for
I hope
that.
the operation comes along as soon as possible.
Yes, so do I.
OK, mate.
Well, I'm looking forward to it, I'm afraid.
See you later. Bye-bye.
Thank you.
Follow my finger with your eyes. Are you getting any blurred or double vision?
Yeah, a little bit.
Where did you get it?
There.
OK. And can you feel me touching you?
Yeah.
Is it about the same on both sides?
Yeah.
Screw your eyes up tight and stop me from opening them. OK, that's fine. Do you wear glasses at all?
No. I had my eyes tested since I was about 14.
OK, well, it'd be worth doing that as well, wouldn't it? Yeah, with all of the symptoms going on.
When you've got kids, you just forget about yourself, don't you?
Yes, you do.
They're more important.
So if you can keep your head still and just focus up here.
Yeah.
Try not to look directly at the light. OK, that's fine. I'm wondering what's going on. And then if I can check your arms as well. So if you can just roll your sleeves all the way up for me. You're being very good.
Oh, that's my tag then.
So can you feel me touching you?
Yeah.
About the same on both sides? You squeeze my fingers? Yeah. Put your arms up like this and stop me from pushing them down. Put your arms in front, push me away. OK, spread your fingers apart like that, stop me from closing them in. OK, that's fine. So with carpal tunnel syndrome, it's very common and it becomes worse in pregnancy.
Yeah.
So it could well be that. The thing that's a bit unusual, though, is... And you've also got some eye symptoms, too.
Yeah.
So I think it's worth referring you to see the neurology doctor, so the specialist.
Yeah.
And the thing we want to make sure this isn't is something like MS, so multiple sclerosis. Have you heard of that?
Yeah, I work in care, so I look after people with all sorts of random things.
And is there any family history yourself of MS?
No, nothing in my family, no.
MS is an autoimmune condition, which is when the body's immune system can attack its own cells. In the case of MS, the immune system starts to attack the nervous system, and in particular, the myelin sheaths, which is a fatty substance that protects nerves. Women are twice as likely to develop it than men. It is also more prevalent in people with a family history and people aged between 20 and 40 years. So that's a referral to make sure it isn't something like that.
Yeah.
And if they think it isn't, then we can look more at the treatment for carpal tunnel syndrome.
Yeah.
And I'll give you a leaflet on carpal tunnel as well.
Yay!
What a good boy you were. Well done.
Bless him.
OK, take care then.
Thank you.
Oh yeah, come and have a seat. How are you?
I'm not very well.
What's been happening?
Maybe you remember.
Yeah, and I saw you, and then you came back. You saw Dr. Ward, and then he gave you some more antibiotics. You had an X-ray.
Yes. First of all, I was coughing, only dry cough, and then started to come out mucus
like
and
brown mucus.
yes, and pain here, especially in my chest. I'm really worried about this problem because.
You had a wheeze. Like a wheeze, like that kind of noise.
Yes, I have it now. Every time you see.
Can I have a listen to your chest again?
Yes.
The X-ray was clear.
Clear, so it is good news.
Very good news. Deep breath in now. Okay. Very surprised by the chest X-ray. It sounds like you've got an awful chest infection.
Yes,
but nothing's coming up on the X-ray.
How is it possible? Maybe they have made a mistake.
One thing though, credit to you, you always smile.
I got no choice. I have a job where I have to smile.
You nice smiley boy. You are.
Here, look up here.
So I don't know you at all, do I?
No,
so,
I feel as if I have met you, but it's because you gave me such a lovely smile.
Oh, thank you.
Oh, OK. Nearly left you a present there. Okay. Does he smile?
Yeah.
That's good.
You're doing well. The smile is back on your face. Very nice.
Eva? Hello, Poppet. You coming to see me?
Yeah, come on down then.
You need to give me that back now.
God, she's so much better at using it than we are, isn't she? Come and sit down. And what's your name?
Eva.
Hello, Eva. How old are you?
I don't know.
You don't know? All right. Are you 15? 4?
Are you 4?
Does 4 sound more like it?
Yes.
And I'm Dr. Bolger, and how can I help you today?
I have a cough.
You have a cough. Okay, and when did this cough start?
I'm talking a couple of days ago.
Temperature?
Not that I've noticed.
Okay. Do you think you can stand down in front of me? Would that be all right? Is she wheezy with this? With the cough, or just sound like a 20-a-day girl?
Yeah.
Shall we have a listen to your chest? How do I do that? Do you know? No.
That's your ears.
That's your ears. I do really well to hear your chest through there. Does Mummy want to bring you across and we'll sit you on the couch? Do you need a hand? I think you might need a hand. Fabulous. Now can you lift that lovely yellow T-shirt up, do you think? That's brilliant. What a clever girl. Do you think you can go, let's all do it. Should we get you down and put you back together again? Oh, careful. Visions of you ending up flat on the floor. So, what you can hear is stuff in the upper airways, not actually on Eva's chest.
Yeah.
I suspect that she's picked up a virus that's given her a viral cough. She doesn't have an infection. I can't see anything to give her antibiotics for. But we know that she has asthma, so the sensible thing while she's coughing is to add the Ventolin to the brown inhaler.
Right, okay.
And then see how she goes. Having said that, if she becomes unwell with it, then we definitely want to see her sooner rather than later.
All right, Eva?
I think you can have your phone and I think you can go, because you were rather a star, weren't you? Yeah?
Little madam.
Bye-bye, sweetheart.
Bye.
Please don't drop that phone.
I know, it's gonna happen.
Bye-bye.
It doesn't quite fit, does it? Because what I was wondering is sometimes you can have a normal chest X-ray, but you might have, so maybe you've developed asthma later on in life, right? But you wouldn't expect to find the crackles, you'd expect to find wheeze, which I couldn't hear. Let me just see something. My main concern, having assessed Tudor was just making sure that I wasn't missing other possible diagnoses. I still thought that this was most likely a bad chest infection, despite the chest X-ray findings. The other thing that I wanted to exclude was a pulmonary embolus. A pulmonary embolus is a clot that shoots into the supply of the lungs and can block off the ability of part of the lung to work properly. Not coughing up any blood?
Blood, no. Only mucus.
I'd like to do a blood test.
Okay.
It's not a blood test we use very often, something called a D-dimer. It can point towards a direction of other kind of problems, like clots and things. I just want to make sure it's not that, so we use it to exclude it, because if the D-dimer is normal, then we don't have to worry about it. So let me just see if they're available to do the blood. Just stay here for a second.
Okay.
If you bring your stuff, you come with me, we'll do the blood test now.
Okay.
Still got like 5 hours of work to do.
I'm just taking a note.
How do you feel about that? Pretend I've got a microphone. How do you feel about that?
Wonderful.
How do you feel about working with me tonight?
Terrible.
Morning, Mr. Gums. Come right in. Just take a seat. This is Priyanka, who's a student sitting in with me today,
Okay.
if that's OK with you.
That's all right, no problem.
Good. How can I help?
Yeah, Wednesday I was putting around in the house, yeah, and all of a sudden my knee it's got pain in it, yeah, and today I can't even hardly bend it.
Is it swollen?
No, that's the thing. It's not swollen.
And it just started out of the blue?
Yeah, out of the blue, just like that.
You didn't twist it
I
around?
didn't knock it, nothing.
And so, what about sleep? Are you managing to sleep OK, or is this...
Yeah, as long as I keep my legs straight.
OK, but if you bend it at all?
Yeah, if I bend it, it's just in me.
So if you can just slip off your shoes and socks and just pop yourself over here and we'll examine
I
it.
started using ibuprofen, but I went to this pharmacy to get some pills. She asked me. She said, "Don't," because I'm on warfarin.
Oh, are you on warfarin?
Yes,
okay.
Yeah, just get the paracetamol.
And so did you take some paracetamol?
Yeah, I took something yesterday.
So just if you can lie over here for me. What's your job? What do you work at?
Social care worker.
Ah, right, okay. So you don't do that much kneeling down or anything?
No.
Just lie back. So just bend it up for me as much as you can bear. Yes, right, okay. Is it up here or down here or around this side or just under it?
It's more near the bottom.
On the lower half?
Yeah,
right,
it's around there, yeah.
Okay, yeah. Can you feel that creaking in your knee?
Yeah.
Okay. Can I just let Priyanka feel it? So you want to just come over here, Priyanka, and just put your right hand on that. So can we just get you to do it once more? Okay, I don't want you to cause pain. Slowly straighten it out. Can you feel that creaking sensation?
I can feel it on the way up.
All right, okay. That's crepitus, okay? They've likened it to a creaking sensation, and it indicates usually inflammation in this setting. And this is inflammation of the undersurface of the kneecap as it rubs against the femur. Good.
That's what it is, yeah? Okay.
Yeah, it is, yeah.
All right.
The reason I got Priyanka to feel Calvin's knee is that there is no substitute for hands-on experience. I wanted her to feel crepitus so that she would recognize it again. Textbooks describe crepitus, but there's nothing like hands-on experience. Ideally, the treatment would be a non-steroidal anti-inflammatory, but you can take those, and you absolutely shouldn't be taking ibuprofen, unfortunately.
Yesterday,
So what can you do? Well, you can take other painkillers just to relieve the pain, and you can put ice on that knee, and it'll settle down if you rest it.
It's really bad getting out of bed this morning, too.
I'm going to give you some codridromol just to reduce your level of pain. But remember, painkilling medication is just to reduce pain. It's not going to heal this. What's going to heal it is rest, elevation, and ice. And that's in your hands.
Okay, right, yeah. I will, definitely.
Good,
Let's start it.
You're welcome. Yeah,
Thanks
nice
a lot.
to see you.
Bye-bye.
Bye.
Yeah, see ya.
I'm after a favour.
What's that?
Can you stay any longer today?
No, I really can't because I'm moving cows. I've got somebody coming to pick some cows up. I'm sorry.
No, don't worry. I'll keep asking.
Sorry, mate. I would have done normally.
Don't worry.
Okay. I can help.
Jonathan, do you want to come through?
You know what? And I really appreciate everything you're doing,
Yeah.
But this is so much agony. There's no point having an X-ray. I know nothing's broken, but
No.
I swear to you, it's getting worse. It's a sleeping. I don't want to be signed off work. It's just no point.
Yeah.
Because my work says, like, if you really want me signed off, but I'm like, there's no point because I can't sleep. I'm not depressed because I'm a strong human being.
Yeah.
Like, but I really am. I'm getting fed up. Not with doctors, but
This is just getting to you.
it's just so annoying.
Okay. Well, I will have another look at your medication.
Is there anything else you can recommend?
I mean, you might think about maybe trying an osteopath to do a little bit around your neck.
Are you from around this area?
Yeah.
Do you know anyone where you can recommend? Not for free, I'll pay for it.
Yeah, unfortunately, osteopath.
No.
There is an osteopath clinic
Oh, where are you
in
talking?
Maidenhead, and
Maidenhead,
I've just
okay,
forgot. I've got forgotten the name of it.
Ask at reception.
Ask at reception.
I bought some new pillows. They cost about 60 quid.
Yeah.
And I feel they're bouncy,
Yeah.
but firm, and I feel my neck a little bit more movement.
Yeah.
So there's no pain on my shoulder now.
No,
it's just
it's
here.
just down there.
It's just there. But I'm weary, obviously, you're a very busy man, so...
Shall we get on and do some of the acupuncture?
And last question, is there anything you would recommend, anything, to just get me sleep at night?
Get into a position that you feel most comfortable in. Make sure you don't have any tea or coffee to drink for about 2 to 3 hours before you go to bed.
Okay.
Or if you do, make it decaf.
Yeah.
And try not to eat for about sort of 2 hours before you go to bed. Right, so if you just come around a little bit for me, that's it. Great. I mean, you did get a fairly good response the last time.
I just wondered, if this doesn't work, how long can this go on for you?
Well, we can do 3 or 4 episodes of these and see how you get on. Now, I'm just going to go quickly up, make a cup of tea, and when I come down, I'll take these out of you.
Thank you.
Okay? So don't go leaning back, because good
I
weakness.
can feel it working.
Can you feel a little bit or
Yeah,
something?
there's no
Good.
spasm.
Okay. Let me just get this cup of tea.
Thank you.
See ya.
So you've had some surgery done, have you?
Yes, I have, yes. I had the carotid artery. Oh, where do you want me?
And then you can, that's it, rest your head back. That's
Yes.
lovely.
You relax? Yeah. Good. She's very stoic.
Do you know how many clips are in there?
About 25, 26, something like that.
Yeah, it's going to be very tender for a while, isn't
I've
it?
had staples out before.
Some of them are, you have to go quite deep down, but these ones are good.
Yeah, all right, Mum. Yeah, just holding my head. That's
This
a tough one.
Yes. You can feel it. We'll go back to that one.
So what exactly did they do?
The main artery was over 70% furred up.
Oh, God.
So it cut her open, cut the artery open, cleaned it all out, stitched it all back up.
Oh, wow.
And she was out in 2 days.
Oh, wow. Fantastic.
She was a strong girl.
Yeah.
Girl.
But
I should be 80 next birthday.
But they said she was a major stroke waiting to happen. So thank goodness.
Yeah.
Thank goodness she had the little one. It's that one, so we just have one more. This little one. Sorry, sweetheart. That's it. No bleeding. I'll just give it a little clean.
One in.
No, they've all gone. I can assure you.
Oh, you take them home if you want.
I've had them long enough, thank you. Thank you very much.
All right, then.
Thank you, Kelly.
Take care, you're welcome.
Bye-bye.
Thank you, bye-bye.
Morning. All right. That was quick. All right, let's get these out for you. Okay, that one. That one.
You're the most helpful person.
Well, thank you very much for sending it. But I mean, I think everybody here is pretty helpful, but people have different expertises and interests. That's them all.
Oh my God. I don't know what that does, but my elbow is no pain. Oh, that is heaven.
Is that better?
Yeah, I can know
Oh, good.
I can move it like
Good,
that.
good. Well, that's good.
I find myself in bed
Yeah,
very quickly. I find myself sleeping like that
yeah.
to try not move it. Oh, that's
Yeah.
heaven.
And unfortunately, the good thing is to move it, because the more it spasms, the worse it gets. That's the problem.
That's right, thank you very much.
There you go.
Oh, cheers.
Right. Well, good. So we'll try and do something on Monday for you.
Oh, that's the reception run about.
Yeah.
Thank you, Peter.
Not at all. My pleasure, Jonathan.
If you would take an incentive, I would happily pay you.
Don't worry, mate. Thank you very much. That's very kind of you to say.
Thank you.
I'm glad you've got some benefit.
Cheers.
Cheers then, Jonathan. All the best.
People keep phoning me trying to sell me things and make me do things.
I'm not interested.
I've been trying to contact you about your PPI. I've never claimed PPI.
They wind my husband up, actually, and when he answers the phone, they go, oh, you had an accident. He said, oh, yeah. Just let me know where it was and when it was, and I'll claim for it.
How can I help?
13th this month.
Yeah.
10 days ago, I had a hernia, spigoelian hernia repair.
Okay.
It was keyhole.
Yeah.
And I got about 10 or 12 little incisions.
Yeah.
And yesterday morning, I was awake all night Saturday night, and I was laying there yesterday morning thinking, sorry, what's wrong? And I was laying like that, and I've got a bit of a lump under one of the incisions. It's almost the size of an egg.
Okay. Let's check your blood pressure. Okay, check your temperature. Okay, temperature is fine. Okay, so if you can slowly come down this way. Right, should we have a look?
A little bit there. Oh, that's
all, is it? Yeah.
It's all there.
Is this the one you're talking about?
Yeah.
It's around the site where the laparoscope instrument has gone through.
Yeah.
That's where it is. So, so there is a mark there too, and I can feel the lump under that mark. Yeah, that's sore as well, isn't it?
So is it tissue? Or?
So yeah, sometimes what happens is what we want to rule out is a bleed under the under the wound, okay, which we call as a hematoma. But it's a slightly bigger than what we normally would see. So I think what you might need an urgent ultrasound.
Come in.
All the best. Bye. Hello. Got a great old knock there.
Come in. Ta-da!
you know, I actually got excited about this.
Did you?
I did. Just a little bit.
Come in. I've got a skin thing that I'm completely befuddled by.
Okay.
So I'll come. Thanks.
Come in.
Hello.
Hello.
Have you done a prescription for an Andrew? Aaron, yes, that's the one. Thank you.
Sorry, I don't know what you are, sorry.
No, that's all right.
Thank you.
Thank you.
Come in. I'm not doing telephones. It's like time to practice in Piccadilly Circus today, isn't it? Hello, come and take a seat. I'm Dr. Allen. What can I do for you?
I've had a really bad ear in the night and it really hurt. And when I woke up, there was blood on the pillow and it was bleeding as well, and I don't know.
Has the pain improved since
The pain has
bleeding?
improved, yes. But I flew back from Spain on Sunday. I don't know if it's the pressure of the blood on that.
Oh, yuck. Oh, it's oozing away, isn't it? Okay, right. So there's no drum whatsoever in there. Lots of bubbles and blood.
Right.
So I think we're going to treat this as an infective cause.
I feel a bit lightheaded. I've got a bit of a cough and a head cold.
You will do, because your ear is your balance mechanism, and when the drum goes, 1, you go deaf, and 2, you feel very unsteady.
If I go swimming and I get water in it, I'm in agony.
It's bizarre. It's like honeycomb. It's like with fluid in it. So what we're going to do today is put you on some antibiotics. You need to keep the ear dry. So when you have a shower, pop, like you had, cotton wool in there to stop the water getting in.
Oh, it woke me up. It was really painful.
Well, it's like having a balloon with the pressure rising.
And then all of a sudden it went goo, 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 goo. And then I looked on the pillow and there was blood on it. I thought, oh, Christ, when you're bleeding from the ear, you know, you think to yourself, you know.
The end is nigh, yes. So, the antibiotic is amoxicillin. Hang on! 1 tablet 3 times a day for a week. Keep your ear dry. I need to book you in for 10 days' time. 1 minute. Oh, it's a lady with important things. Do you mind if I get my tea and cake?
No.
Oh, you know what I'm having.
I know.
Thank you. Thank you, ladies. Thank you.
No, I can't have them because I go to the Healthy Heart.
Oh, right.
What Dr. Joanji done for us, and I've got 2 more weeks of that to do, and tomorrow we start doing the gym work.
OK, well, let's see if this heals, and then we'll take it from there.
Thank you very much,
Take care of
anyway.
yourself.
Thank you.
All
Bye-bye.
right, bye-bye.
I was in KFC yesterday, right? This guy behind the till, he was like, whereabouts are you from? Because you sound like someone from Jersey Shore. I was like, what? Oh, no, made in Chelsea. Where's that? Where's Chelsea?
London.
They took Willie Porsche. So do I.
Hello, hi, is that the surgical registrar? Yeah, hi, Dr. Sheikh here, one of the GPs. Just wanted a bit of advice. I wanted to discuss about a patient, 50-year-old lady. She had a laparoscopic right vigilant hernia repair just 10 days ago. She has noticed a painful lump at one of the incision site. No sign of infection. I don't think there's an infection, but the lump is a bit worrying too. I think she needs to be seen, yeah. All right, can I send her through? Thank you, yeah, bye. So are you okay to go straight from here?
Yeah.
And your heart rate is slightly high as well.
Is it?
That can sometimes be due to pain.
Yeah, what was it?
It's 100.
100?
Are you stressed? You've been thinking about it?
Yeah.
I think you must be worried about the lump. It's unusual, and that's probably just getting your heart rate up a little bit. And you're in pain at the moment, so...
And you're in pain as well, yeah. Okay, so if you take this letter to A&E, and they would call the surgeons to see you in A&E.
Oh,
okay,
lovely.
all
Thank you
right.
for seeing me
No
today.
worries. Take care, and I hope everything goes well for you today.
I'm sure it will. If
All
not,
right,
I'll have
take
to
care.
punch her. Thanks, Doctor.
Thank you.
Thanks very
Bye.
much. Bye-bye.
Can I make an appointment from Sister, please?
Just Dr. Bolger, yeah?
Is indeed, yeah.
She's a popular woman, isn't she? I always say she's a bit like the Wizard of Oz.
Yeah.
We went to see that Bridget Jones's
Oh, was it good?
beer I keep wanting to say diary.
I did see the other two, so I just wondered if it was silly or, you know, a bit too silly.
It's not too silly, no.
Oh, that's good.
No.
Have you seen the recent Panorama program about diabetes, the hidden killer? No?
I must admit, I did like Hugh Grant in it as well.
Yeah, he's not in this one, no.
He's in it though, isn't he?
Colin Firth.
Yes, he's
Colin Firth's in it, yeah.
Colin Firth is lovely though, isn't he?
Okay, how can I help today?
I had my blood pressure done, and then the pharmacist said to come and have a chat with you about it.
And what did they say to you about your blood pressure? And
it was a little high again. Yeah.
Have you known to have high blood pressure before, or?
It was high like 10 years ago.
Right.
And it's been good ever since. But
That's
we've had a
brilliant.
lot going on in the family this year, so...
Okay, I'm sorry to hear that. Is that to do with your immediate family, or?
Yes, we've had 7 deaths in 5 months in the immediate close family members.
Oh, I'm really sorry to hear
So
that.
I'm not surprised
So you've been
that...
through so
yeah,
much.
Yeah.
So no wonder you're...
Yeah, not surprised that
Okay.
it's all over the place at the moment.
Have you had strokes, heart attacks before? Nothing like that?
No.
Known to
no.
have any high cholesterol?
Yes, I suffered high cholesterol.
Okay. And anything in the family, like any type 2 diabetes, heart attacks, strokes, anything like that in the family?
Oh, yes. My dad had high blood pressure. He had a stroke. My mum had a stroke. She had heart problems. She was diabetic. My sister's diabetic. She has heart problems.
So it's quite... Yeah,
So it's in the family.
It's in the family.
Yeah.
The simple matter is we just start you on one tablet at the beginning to see if we can control your blood pressure, because obviously the 10-year risk of having high blood pressure are things like, unfortunately, heart attacks and strokes.
Yeah.
So we need to minimise your risk because you've obviously got the family history. And we need to do the urine dip and the ECG.
Okay.
Oh, you've done the ECG. Your ECG was normal. The only thing now you need to do is book in with the nurse in a week to get the urine sample. Should we do your...
Yeah, because I mean...
And then just relax your arm like that for me.
My problem is that there's 3 people at home that depends on me.
Right. Who do you live at home with?
My son's epileptic, so I'm his carer.
Oh, my goodness.
And then he's got twin 6-year-old.
He's got twin 6-year-olds himself, right?
Yeah, and one's type 1 diabetic, and the other one's ASD.
Autistic.
Oh, he's autistic.
Spectrum disorder.
Yeah, and I suppose I'm just a little bit stressed.
So no wonder all the stress is just... Right, just try and take deep breaths.
My brother-in-law died, and then like a month later my mum died. She first had to go to the Caribbean, and while we were out there, her cousin died.
16585. So again, it is, and your pulse is weirdly low. Sorry, I'll take this one here.
Her friend died the week before we buried her, and the week after we buried her, her cousin died.
I thought Caribbean's would relax the person. Oh my God.
And then the day I came back, I heard my dad's cousin had died.
Right.
So then, okay, no more.
God, goodness. I think we should really start the 5 milligram amlodipine because I think you're at that borderline, and with your really strong family history.
Yes, I think we're better.
Yeah. And in a week's time, the nurse will recheck the blood pressure to see is this tablet working on you.
Okay.
If your blood pressure hasn't come down within a week, we know it's not the right, either we increase the dose or change to a different tablet. Is that okay?
Yeah, that's fine.
Perfect. Oh, did I give you the prescription?
Yeah, I've got it in the
lovely.
bag.
Take care.
Thank you very much.
Bye.
This is my Mandy, your mum's friend, Vivian.
Oh, okay.
Yeah.
Hello, I've just been for an ultrasound and they've given me this report to give back to
I don't want it.
my friend Dave Ward.
Is your friend, is he?
Yeah,
Cool, you're one of the few, are you?
I like him.
I know, we so do we, darling.
Hello, here's my friend. How are you? Come on, let me have the chair up, please, so I can see you. There we go. That's better. I love your wheelchair. I think it's brilliant.
Mrs. Brown? Hello.
Hello.
I'm Barbara.
Nice to meet you, Barbara. You've got one nervous patient here.
You'll be fine. Just remember to breathe.
To breathe?
Yes.
Yes.
Don't hold your breath, breathe.
Just breathe.
It'll take just a minute and we'll be done.
Correct me if I'm wrong. Are there two sizes of the
speculum?
Yeah.
There are actually 4 sizes. It's no more metal. When you did before, it was a cold metal. It's a plastic that I run under warm water so it's warm. It's not cold anymore.
Okay.
And I promise I will not hurt you.
I've got every faith in you. I just think it's very, very important that we have it done.
Yes, it is very important. And I'll make sure I tell you what I'm doing.
Okay.
So you're not nervous.
Okay.
All right. It is a screening test, so it's not a diagnostic test. So what I'll do is I'll take a sample of cells and I'll send it off to the lab. At the lab, they'll check for any abnormal changes within the cells. If there's any abnormal changes, they do a further test on the sample called the HPV test.
Okay.
So HPV stands for human papillomavirus. So I'll pull the curtains around you. Take your lower bits off for me.
Yes.
And get on the bed. Give me a shout when you're ready.
Yes.
And I'll do this.
Okay.
Okay.
Will do. Thank you, nurse.
Okay.
Thank you very much. Oh, these are much better, aren't they?
Yeah. I put this here so you can put your trousers and stuff
Lovely.
on.
Thank you, nurse.
All right.
Thank you. You'll have to really excuse me if I'm a baby.
You're fine. Trust me.
Oops, daisy. There you are.
Can I come in?
You may.
All right.
Is that okay?
Yes. You feel my hand first. Okay. And then the speculum. Remember to breathe for me. Sorry. Well done. That's the hardest bit done. Relax. Okay, try and relax for me. What do you like doing?
I like jigsaw puzzles, and
do you?
They're my favourite.
Sorry.
Oh, I know you want me to relax, but oh no!
I am so sorry.
Your cholesterol tablet, are you not taking them?
No, I'm not.
Why is that?
Because I'm getting forgetful in my old age.
You're only 49. You're not old.
You know how I found that I was low on vitamin B12?
No.
I kept on forgetting things.
Do you want it written down? Yes, please, because I will forget, because I've got so much to do today for tomorrow.
I fell down the stairs last year. I lost my memory for nearly 4 weeks.
Oh, gosh. It's the worst, isn't it, the baby brain?
My other sister, she's pregnant, and my God, her baby brain. I'm just like, I just told you that.
You're taking 2 sorts of tablets for your diabetes, yeah?
I skip sometime, not every day.
Why? Why do you skip?
I forget.
Oh, okay.
How can I help today?
Yesterday, I noticed I've got a gash on my leg. Now, I don't remember banging it, but the way my legs are feeling recently is if I even trod on a nail, I don't think I'd feel it. They feel like
You've got diabetes, haven't you?
border.
OK. It's not looking like it's spreading anywhere.
Right.
It looks like it's all kind of staying in one place, which is what we want it to do.
Do you think, in your observation, you think I've knocked it?
It looks like you may well have done, without perhaps realising it at the time.
Yeah, because when you're younger, you hit yourself and you go, and of course... But I'm getting older, so I'm forgetting things, but I don't remember banging it.
Sure.
Not
OK.
at all.
In patients with diabetes, wounds can often tend to heal quite slowly, mainly as a result of impaired circulation and nerve damage. And the risks of this ultimately are long-standing infections, gangrene, ulceration, and ultimately amputation in some cases.
Look how swollen I've become. Isn't it terrible?
Okay. Is it the same both sides?
Yeah, both sides,
Swelling-wise?
yeah.
OK.
Since an operation. All the scabbiness and the dryness. Now I can't bend to grease my skin, whereas I did before.
Oh, right, OK.
My kids are half Indian, half black, so oiling my skin was a natural phenomenon. But
Yeah.
I can't do any of that now.
You mentioned that you can't reach. Is there somebody that could?
I've only got a 21-year-old boy at home,
OK.
and him being a young fella, I can't say to him, can you grease me?
Why not?
I think that if I asked him to do it, I just don't know, I just feel too embarrassed to ask him.
It looks dry, and when skin is dry, there's a chance of it cracking, and when skin cracks, infection creeping in. So the win-win situation here would be getting somebody to perhaps apply some decent emollient on a regular basis.
Really?
Can I prescribe you some?
Yes.
So that you've got it.
So I've got it. Then if someone comes, I said, this phase, stick that on.
Yeah, absolutely. There's two things I'm going to prescribe. The small antibiotic cream for the slight kind of abrasion there.
Yeah.
The other one is a tub of emollient.
Yes.
This one comes in the form of a gel.
Must be something new. That's amazing.
That's all done for you.
OK, sir.
All right.
And you.
Nice to meet you.
Nice to meet you, sir.
Take care.
See you again. God bless.
Bye now.
I am so sorry.
Don't be sorry. You haven't seen me getting mine done.
I'm going to...
I'm like a chicken, screaming all over the place.
Was you nearly there?
Yes. So I've got gel on this to make it easy for you, OK?
OK.
All right. Relax. Deep breath for me. There it is. I'm so sorry. I have found it. Remember to breathe. I'm going to take the sample.
Oh, dear.
I know.
That is the most uncomfortablest thing I've probably ever had, but I don't care how.
I am so sorry.
Oh.
So I'm done.
You done it?
Yeah.
Did you get one?
I did.
Oh, I'm so sorry.
Don't apologise. It's only natural.
Barbara, I can't thank you enough that that you've managed to do it. I really can't.
You are fine, and you're welcome. If you don't come, I don't have a job.
So I just wait now, Barbara.
Yes.
To hear if
there's anything, they'll call you on the telephone number you've given me, and they'll refer you on for treatment. If everything is okay and no abnormal cell is found, you have your result as a letter to your home address within 3 to 4 weeks.
Yeah.
And the hospital will decide whether we see you again or this will be your last.
And if they do want to see me again, I'm going to say that I want Barbara there.
Oh, thank you.
Thank you very much, Barbara.
You're welcome.
Really appreciate it.
You're welcome.
Thank you very much.
You're welcome.
Very kind.
Thank you. All right. Bye-bye.
That's scribbling.
It's scribbling, yeah. It's my neat writing. It takes a long time to learn how to write like that. All right. See you later. Take care. I absolutely love my job. I couldn't see myself doing anything else. I genuinely enjoy getting to know my patients, knowing everything about them, all the ins and outs and what makes them tick.
It's been a good relationship between us both. Well, I've enjoyed it.
Good, so have I. It's been a pleasure looking after you. I can remember sitting in my GP surgery, aged 8 years old, not feeling very well, and the GP telling me what he thought was wrong with me and what was going to happen. And I just remember thinking, wow, that must be great.
Best thing about being a GP is that you are given insights into patients' lives that they will not necessarily give to anybody else, and that's a real privilege.
There's always challenges, there's always surprises, and it's just never the same thing every day, so it's just such a worthwhile job.
Quite happy today, I'm quite surprised.
It's because I'm positive again.
Good.
I've had 6 months, but I'm just got on with things. See you later. Bye-bye.
When I wake up in the morning, I feel great to come to work. Very few people can say that. You're a great survivor.
I keep going.
We enjoy the work, despite how hard it is. We enjoy going home at the end of the day, like everybody else, knowing that we've probably helped a lot of people. I don't know any GP, particularly those I work with, who don't feel that to be the case.
Bye-bye, dear.
Thank you. Well, dear.
Where are you?
Thank you. Well, have a nice day, doctor.
Yeah, and you.
Thank you, doctor.
Bye-bye.
Being a GP is absolutely a vocation for me. It is the reason I breathe, it's the reason I live, it's the reason I get up in the morning, and it's the reason I go to bed at night contented.